Good evening guys, this is Dr. Paul. Once again, thanks for taking your time tonight to watch this video. As always, we request you to visit our website at www.usmlevideos.net. Tonight I want to talk a few minutes about AIDS and the disorders associated with it. As you know, AIDS is the end stage of HIV infection. It is characterized by opportunistic infections, malignant neoplasms, and neurological disturbances. So opportunistic infections, malignant neoplasms, and neurological disturbances, these are the characteristics of AIDS. At that point, we should say that HIV has reached its final stage. So let us see some of the most common things. Number one, CNS lymphoma. This is the most common brain tumor associated with AIDS. You can diagnose CNS lymphoma using an MRI or CSF analysis or a brain biopsy. And you can treat this with radiation therapy and combined with steroids. So that is about CNS lymphoma. The next thing is HIV associated dementia. Whenever the patient presenting with the fatigue, difficulty with reading, or comprehension problems, that is the stage that you should say that patient has HIV associated dementia. You should start the patient on HAART and also on psychotropic medications for this problem. The next thing is cerebral toxoplasmosis. Cerebral toxoplasmosis presents with confusional state. The patient presents with confusion, sometimes that mimics delirium, the fever, cranial nerve pulses, seizures, and headaches. And it is diagnosed with MRI. You use an MRI and you see ring enhancing lesions. That's a very, very important clue. When you see ring enhancing lesions on MRI, it is cerebral toxoplasmosis. You should treat these patients with clindamycin or pyrimethamine. And when you treat patients with pyrimethamine, you should give them folinic acid in order to treat thrombocytopenia associated with this problem. Next thing is cryptococcal meningoencephalitis. It is presents with fever, malaise, headache, and photophobia, stiffness of neck. And whenever you see cryptococcal meningitis, you should immediately start patient on IV amphotericin B. You can also use the flucytosine or fluconazole. The next disease important is CMV retinitis. CMV retinitis is present with photophobia, visual disturbances, blindness, scotomata, and the most common ocular finding is cotton wool spots. That's very important. Cotton wool spots is characteristic of CMV retinitis. You should treat this patient with ganciclovir or foscarnet. Very, very important, pneumocystis jirovecii. This is pneumonia. Produces fever, non-productive cough. So pneumocystis jirovecii pneumonia, you should treat it with trimethoprim sulfamethoxazole. That's a very, very important point, and you can make sure that this is the question you are going to see. Then cytomegalovirus. Cytomegalovirus causes GI diseases, esophagitis, gastritis, colitis, enteritis, and you should treat it with ganciclovir or foscarnet or valcyclovir. So that's about most important infections. But you can also think about oral candidiasis. Treat with nystatin or clotrimazole or ketoconazole. So oral candidiasis is very, very common in HIV or AIDS patients. Then Kaposi's sarcoma, the most common malignancy encountered in HIV infected patients, that is Kaposi's sarcoma. It is associated with the HHV-8 virus. It's primarily a disease of men. It involves skin, oral cavity, lungs, and the digestive system. Kaposi's sarcoma, how do you treat it? Chemotherapy, radiotherapy, laser, and cryotherapy. Those are the 4 kinds of treatments available for Kaposi's sarcoma. Then also you can think of hairy leukoplakia. It is present with aphthous ulcers, and hairy leukoplakia is usually treated with triamcinolone. Now, one more important condition in AIDS is pericardial effusion. Most often asymptomatically it occurs. So the most common pericardial abnormality in AIDS patients is pericardial effusion. It does not need treatment because most often pericardial effusion, it resolves spontaneously. So basically those are about AIDS related diseases. Now let us see an important disease. For example, a patient 36 years old presented with fever, dyspnea, weight loss, and on physical examination you heard crackles and rhonchi on auscultation, and you took an X-ray and you saw bilateral interstitial infiltrates, and you took a lung tissue by bronchial lavage and you saw cyst-like organisms. What is the diagnosis? The answer is Pneumocystis cerevisiae pneumonia. That is previously known as Pneumocystis carinii pneumonia. So these are the main diseases you need to remember, and I hope you do better. And as always, you can visit our website at www.usmlevideos.net. That is www.usmlevideos.net, where you can browse through hundreds of our videos, and we have posted in fact diseases and so many questions for our review. Thank you very much. God bless you.